Today, I am joined by bariatric surgeons Dr. Michelle Muir and Dr. Marco Antonio Rajo. We'll be answering some of the most prevalent questions our team members receive as it pertains to weight loss surgery options and how our expert team members are using some of the most minimally invasive pieces of technology and techniques to make you feel whole again. But before we get to the docs, I'd like to invite you to please submit any of your questions or concerns as it pertains to this topic in the chat box below, and we'll be sure to break at the end and answer some of your questions. Dr. Mira, let's get right to it. Talk to me a little bit about what exactly is obesity and how prevalent is it in our community?
Thank you, Raphael. That's a important question. So we define obesity as excess body weight, mostly adipose tissue over the body and inside all the organs. Now, obesity is a serious disease, and it has far-reaching medical consequences and quality of life consequences for patients. Now, obesity is at the root cause of diabetes, hypertension, sleep apnea, fatty liver, hypercholesterolemia, and the metabolic syndrome. So it makes a lot of sense for us doctors and patients to pay attention to body weight and to make sure it doesn't affect the quality of life or get patients into complications of the metabolic syndrome.
And Dr. Rajo, there are so many options as it pertains to weight loss journey for many patients. Talk to me a little bit about what are some of the options that you provide your patients.
Great. So the options for weight loss surgery are varied, and we try to tailor our approach based on a patient's specific needs. In our practice, we find that depending on what a patient's comorbidity profile may be, we're typically looking at one of two surgical options. It's usually either a sleeve gastrectomy or a gastric bypass to address their excess weight.
And Dr. Mir, over time we hear it time and time again. As the years go by, science and medicine continue to evolve. So talk to me a little bit about what have been some of those advancements in the world of weight loss surgery that we should be proud of.
We've been doing bariatric surgery for a long time, and we learned a lot of lessons in the last 20 years. One, and the most important part is bariatric surgery is safe, it's effective, it treats diabetes and all the components of the metabolic syndrome. The second most important part that we learned is once a person reaches a high weight, around a BMI of 40, meaning twice ideal body weight, the diet and physical activity that we prescribe to lose weight on patients with lower weights does not work on the upper weights. The physiology of body weight regulation changes dramatically when the weight goes up, and we tell patients the thermostat is of your weight is up here, and there's very little evidence that if you continue doing diet and physical activity, that thermostat will go down. Surgery will bring the weight down, will disrupt the physiology, bring the weight down to a lower weights where continued physical activity and diet and as well behavior modification, lifestyle modifications work very effectively. That's the second thing we learned. And now we know beyond the shadow of doubt that the long-term benefits of bariatric surgery include remission of diabetes, regression of fatty liver, control of blood pressure and hypertriglyceridemia, and a lower incidence of cancers that come with obesity, and also a lower incidence of heart attacks, strokes, and cardiac events.
No, no, that's great to know. So lots has been learned. Dr. Rajo, I know you practice out of Advent Healthcare, where there is a large Latino community. Talk to me a little bit about how prevalent is obesity in that community, and what are some of the trends that you're currently seeing right now?
Yeah, great question. So nationwide, right, we've seen that the incidence of obesity has gone up with every passing year. Even when we break it down by like population subtypes, there are certain patient populations that are more at risk than others. One of those populations happens to be the Hispanic and Latino community, and that comes from a variety of reasons. Some of them are cultural, some of them are food access sort of approach, but definitely a population that is at high risk. We see it very commonly in our patients.
Would you say that over time the trends continue to go in that upward direction, or are you seeing that the community is starting to tap into more of their medical resources to learn and to hopefully, get back on track as it pertains to healthy eating?
You know, that's a great question, and I will tell you that. So overall, we're seeing that there's more and more people who are struggling with obesity. As we raise more awareness about obesity as a disease, right? Something that as we're working very hard through situations like this where we're trying to remove some of the stigma around a disease, then that encourages more and more people to seek medical care. Even to this day, though, there's probably only 1% of the people who qualify for a weight loss intervention who are seeking that medical care. So opportunities like this allow us to address some of those concerns that patients may have and encourage them to continue to seek care.
Perfect. Dr. Mir, we hear it time and time again as well that the weight loss surgery option is just kind of an easy way out. So, talk to me a little bit about, from a medical perspective, why it's not an easy way out and why it could ultimately benefit patients who so desperately need this care.
Well, let's debunk that myth, right? So it's never the easy way out. It's surgery. It's a big deal. We do it through minimally invasive techniques, so we make it less traumatic to the body. But when people come in to see us, they have reached the end of the ropes, dealing with their weight and the complications that come with it. So for somebody who's been trying for many years to control their weight so they can control their diabetes, there's no better alternative than to say, well, let's bring your weight down with surgery. So the easy way out would be not to do surgery and continue with weight and stuff like this. But patients who go through surgery have to be prepped really, really intensely. So we put them through diet and behavior modification and multiple visits with our team before surgery to prep them for success afterwards. And after surgery, they are driving their weight by adhering to dietary advice, portion control, healthy eating choices, and daily physical activity. So they do a lot of heavy lifting after surgery to keep their weight down. And it's not an easy task at all. It's really, really hard. And people who go through it love the fact that they lose weight and their comorbid conditions get better, but they'll tell me that it's a tough road to go.
How complicated would you say is it for these folks that go through this journey to keep that weight off? Because I'm pretty sure that it's not just preparing for the surgery, but life after it as well.
So life after is very interesting. A lot of people enjoy it, see the weight come down. They get off their medications for diabetes. They stop using CPAP. Their blood pressure normalizes. Now they can do activities of daily living and enjoy their family and children without any difficulty. Many younger women are coming forth, and they could not get pregnant because of weight and infertility. Now they're having to build their own families, and they enjoy that part. The thing that we emphasize to everyone is once the weight is down, we have to keep it down with daily being vigilant about healthy eating choices. And because not everyone can do that and sustain it for a long time, we ask patients to come and see us every 3 to 4 months, and we want to see them for life. We want to catch their weight before it goes up that way or goes in the wrong direction. And therefore, we have a multidisciplinary team with dietitians and psychologists and physicians and nurse practitioners who pay special attention to weight control and can help patients in dealing with their weights after surgery.
Dr. Rajo, you're very active on social media, and that is a platform that nowadays most folks go to showcase their lives. And it's also a place where I've noticed that folks like to show transformation. So, as it pertains to this topic, talk to me a little bit about what are some of those transformations that you've seen over time, and how does that fulfill you as a surgeon to see folks come in a certain way and then over time evolve and become the best version possible of themselves?
Yeah, I'll tell you, the probably my favorite part of doing bariatric surgery is the interaction with the patients. It's a very distinct patient community, and they've worked very hard to go through something that's been a challenge to address a problem that they've had for a very long time. And as they lose the weight and regain control of some of the things in their life, then they it's transformational for them. It's really honestly inspiring to see the people go through this kind of an operation, lose the weight, feel better, and start doing things that that they weren't able to do before. There's a concept that's commonly referred to in social media, right? Like the whole non-surgical victory, that NSV, hashtag NSVs all over the place on social media. And it's crazy the kind of things that we take for granted, but it can be so difficult for people who struggle with severe obesity. And it's fantastic to be able to see them. It's honestly probably the reason why I continue to be involved with social media, is to be able to maintain and develop these relationships with people who've been able to succeed and who are years out from their operation are still doing great.
No, that's amazing. Dr. Mir, I know one of the big positives of our Advent Health team is the fact that we have, our bariatric team in the access to our institute. Advent Health spans across multiple states. So, talk to me a little bit about the benefits of patients coming to Advent Health in comparison to somewhere else.
Well, let's talk a little bit about that. So, what sets us apart from everyone is the quality of care that we give. We are five bariatric programs spread out around the West Florida division of Advent Health in Ocala, in Sebring, in Dade City, in Carrollwood, where Dr. Raho is, and in Tampa, where I am. And we come together as an institute, which means we put forth a vision that we will deliver the best care available in an interdisciplinary team approach with personalized care to pay attention to holistic care for patients. And we use evidence-based medicine to guide our treatment. So any patient who comes into any Advent facility that does bariatric will get the same quality care and the same trained surgeons. And we do the same follow-up, and we will help them for long-term follow-up and care. This is a big investment from Advent Health to do this. And we are pioneering this among the area, but also nationally speaking. Very few hospital systems have gone into this area where they can put multiple programs together and make them into an institute of excellent care.
No, that's great to hear. Definitely, having the options to tap into robust offerings is amazing. Dr. Raho, um, it's a scary decision. It's a scary process. So, talk to me a little bit about how your team guides patients from the very beginning to the very end.
Great. Yeah, so it's a process. I'll tell you, there's a lot of steps for us to complete as we work with a patient in order to get them ready for a safe operation. The biggest thing I would tell you is that knowing the surgeons who are in our division, right? Knowing the people who work with Advent Health and the people who decide to dedicate their careers to bariatric surgery, by and large, a very empathetic group of people, right? A lot of this is about teasing out the concerns that a patient may have when they are considering a weight loss operation, and trying to address as many of those as early as our very first visit. So we take great pride in being able to spend that time with our patients, and trying to figure out what it is about the process that's concerning to them. And as we go from our very first encounter to the date of surgery, we meet on a very regular basis, and they meet with the other points of contact within our care team, right? They meet with their dietitians, they meet with their other health professionals. We get them screened for all the other associated medical conditions, and by the time that we are looking at an operation, then we've asked every question, we've addressed every concern, we've provided them with all the information that they need, we've made sure that they feel comfortable with that information, so that when they go through surgery, they are ready, they feel informed, they're an engaged participant in what's coming. And even though there may be apprehension, because it's difficult to be able to tell you exactly what your life is going to be after a surgery, even though there's always that question mark, they know that they have everything that they need, all the tools that they need, and the support system in Advent Health that can help them succeed after surgery.
Before we end, I'd like to hear from the both of you. Any last words? Anything that you think I've missed that might be important for the community to know? We can start with Dr. Mir.
Well, let's address the obvious that we didn't address already. The link between obesity and mortality from COVID is big. It's has been borne out by multiple studies. And so patients with obesity who contracted COVID had a higher likelihood of complications from COVID, hospitalization, longer ICU stays, and higher mortality. So that link is very strong. And the newer studies now show that patients who had bariatric surgery have less complications if they were to contract COVID. So this is very important for us now to tell people, look, as part of what we do for obesity and its complication, we got to keep an eye on weight during the pandemic, and that's driving a lot of people to seek weight loss and bariatric surgery.
Dr. Rajo?
I will tell you that one of the things that's important to remember is that obesity, just like anything else, is a medical disease. It is never too early for you to start seeking care for a medical condition that is impacting your life. So even though there may be a lot of concerns about, surgery being an easy way out, like we previously discussed, allow me to reassure you that it is not. It is, in fact, the most effective treatment for a medical condition. And like all things, it should be treated seriously, but it's also one of those things that can really transform your life and make you feel whole again.
Thank you both so much for sharing your expertise with us today. And for those of you watching, if you have any questions or concerns, again, please don't hesitate to reach out to us. We'll be sure to answer in a timely manner. Thanks so much. Have a good day.
Thank you,
Thank you so
Raphael.
much for
Great
the
to be with you.
opportunity.